5 years.
June is National Migraine and Headache Awareness Month, a time to recognize the importance of preventing and treating migraines and headaches. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Karen Morgenstern-Jacoby, a headache and facial pain neurologist at the Queen's Medical Center. Aloha, Dr. Jacoby.
Hi.
Thanks for joining us this morning.
Thanks for having me.
So tell us, what is a migraine? How do I know? How does the public know if they have one?
Absolutely. So migraine is actually a complex neurological disease. It stems from the brain, and it's incredibly common. It affects 1 in 4 households in the U.S. and up to 1 billion people worldwide. The most recognizable symptom with migraine is headache, but migraine is so much more than just a headache. Many people experience other symptoms like nausea and vomiting, light and sound sensitivity, irritability, fatigue, and that really affects people's quality of life. Now, there's no specific test to diagnose migraine, but it's diagnosed clinically after a discussion with your doctor. So it's important to keep track of all of your symptoms so your doctor can best diagnose you and treat you.
Very good to know. Now, some people, I know they have migraine attacks. How can you prevent a migraine attack from happening?
Yeah, absolutely. There's so many great ways to prevent migraine attacks. And like you said, when people get a migraine attack, the most common way we think about treating it is, okay, I get an attack and I take a medication. That works great if people aren't having that many attacks. But once they become more frequent and more bothersome, we really want to focus on prevention. I start to recommend prevention when people are having more than 4, attacks in a month, but sometimes even sooner if people are really disabled or having really severe attacks. I recommend starting prevention with lifestyle factors. So getting really good and high quality sleep. If you're snoring, ask your doctor about looking into that. That can affect it. Eating a balanced and healthy diet, staying really nice and hydrated, and doing a lot of activity and exercising. On top of that, if people want to take something for their attacks, there's vitamins and supplements that if you take every day, over time can help prevent headaches as well. My favorite is magnesium. Super great for headaches, also great for sleep, muscle cramping. So I really love magnesium, and you can talk with your doctor if that's a great one for you. I always recommend discussing it with your provider, because even over-the-counter medications have the potential for side effects.
Good to know. And then just to close off for today, how does the future of the preventative care of migraines really look like? Mm-hmm.
Yeah, so, great time in migraine, lots of new things coming out, which is very exciting. So I always encourage people, reach out to your doctor. There might be new things that there weren't back when you talked to them before. But I really do feel like the future holds, in better education for our primary care doctors. They're going to be the first stop for patients when they're experiencing these things. So, what we're doing right now at Queen's is really improving educational resources, access to a specialist for our primary care doctors. So I really recommend for patients, if these are starting to affect your daily life, talk to your doctor. And then I also recommend for the patients, as well as our great primary care doctors, reach out to us headache specialists, for additional guidance and all of the new treatments that, we can help with.
Thank you so much. Well, to learn more about the services provided by Queen's Neuroscience Institute, you can visit queens.org, click on Services, then click on Neuroscience Institute, or you can call 808-691-8866. Thank you so much.